Good day. My name is Dr. Kojusabi. I'm the Medical Director of Komfo Anokye Teaching Hospital. Let me take a few minutes to talk about cancers. This hospital is located in the middle belt of Ghana, and we receive referrals from the 10 regions around us. We are a very high volume facility, and we see a lot of cancer cases at Komfo Anokye. In fact, amongst the top 3 cancer cases we see at Komfo Anokye are breast cancer, cervical cancer, and prostate cancer. So, breast and cervical cancers are mainly in the female, though you can have a few males who can also develop breast cancer. Prostate cancer is in males. These are the top 3 cancers we see at Komfo Anokye Teaching Hospital. Cancers generally take time to develop, and so one of the primary or one of the best measures that one can put in place to reduce the incidence of cancers is to pick it up early. And this is done through one, health education, for people to check on their lifestyle, eating habits, where they can go to, what they can be exposed to prevent cancers. The other thing we do in this hospital is screening. Screening is a tool that is used either through physical examination or laboratory tests to be able to detect the incidence of these cancers. For breast, mostly examinations are very key. Examinations can pick growths within the breast easily, which can then be followed up for treatment. For cervical cancer, a lot of women, when they have even vaginal discharge, may be experiencing early symptoms of cervical cancer. But one thing is that once you get infected with a human papilloma virus, which is known to be the cause of about 70% of cervical cancers, it takes a very long time, between 10 to 15 years, for one to develop cervical cancer. And because of this long latency period, screening using the pap smear or HPV DNA testing is known to really help to pick up early cases for treatment. Now, one of the best things about cancers is that once a diagnosis is made, the cancer is located within its space. Most of the time, the treatment of such diseases is quite easy for us as health professionals because we are able to zone in and even remove the entire cancer from your body. The hospital has a lot of these preventive measures available through health education program at our outpatient clinics. We also do opportunistic screening for our patients who present in for even other services can always ask whether they want to do a breast screening, whether they want to do the pap smear mainly for cervical cancer, and then we can also arrange for a urologist to attend to you if you want to be screened for prostate cancer.
I'm Dr. Danielson. I'm a clinical oncologist here at the Komfo Anokye Teaching Hospital, the Department of Oncology, to be precise. I also serve as the lead clinician of the department. As most of you have heard by now, cancer is increasing in incidence in developing countries like Ghana. So a lot of us we have had a relative or know somebody in the community who has ever been diagnosed with cancer. And when you come to my department, we see all forms of cancer. And the commonest cancer that we do see is the breast cancer. We also have cervical cancer, prostate cancer, cancers of the bowel or the GIT, that is colon rectal cancers. We also see cancers of the skin. Um, Sometimes cancers of the brain also come around. So cancers from head to toe. In fact, brain cancers, also the cancers of the head and neck. If you take out, if you examine the head, the brain is occupying the uppermost part of the head, which is covered by part of the skull. Beneath that is the rest of the head, which is also prone to a lot of the cancers that we see. So we have patients who come here with all kinds of head and neck cancers for all the sides, like from the nose, behind the nose, in the mouth, in your throat. There are cancers that can affect all these areas. So we see cancers from head to toe, I would say so. So these are the commonest cancers that we see. So breast cancer is the leading cancer diagnosis we have in Ghana. We need to demystify some of the misconceptions that we have about cancer in general. For example, you will hear patients come here and say that, Doc, with this diagnosis of cancer, it means I'm dead because for cancer there is no cure. But that is not true. It depends on the stage that you present. If you do present at an early stage, there's cure for you. The only time that cancer will not have a cure and turns into a chronic disease where you need to take medications every day to control the disease, like you have hypertension or diabetes, it's when the cancer has already spread to other parts of the body. Like, let's say the cancer started in your breast, but you now have the cancer invading or spreading to your lungs or your bones or your liver or any part of the body. When this occurs, it becomes like a chronic disease like hypertension, diabetes. That means you need to be on medications for the rest of your life. And when this happens, then we will term it palliative. That means we are not curing. However, if you present early, stage 1, stage 2, stage 3, there's opportunity for you to be cured. That means the treatment that you are going to receive has an end. You have to end at some point for you to be free of the disease and free of any treatment. So we have evidence of many patients who have undergone treatment successfully and now they are in remission. That is, they are cured. They only come here for follow-ups. They come and then present themselves for us to see how they are doing. But effectively, they have no disease in them. We have patients who have lived for 10 years, 15 years, 20 years, and they are fine. So the conception that cancer cannot be cured is not true. The only solution is for you to come early. That is, you being able to detect any abnormality, any part of your body, anything unusual that you don't understand, any part of your body. You have to seek medical attention. Then that may be the beginning of the diagnosis of your cancer. So if, for example, if it's your breast, if you notice that there's a small lump or any abnormality with your breast, even if you don't feel a lump, any changes in the skin of your breast or any part of the breast, you have to quickly go to the hospital. And then the cancer could be diagnosed if it's really a cancer. And after the cancer diagnosis, then when the staging is done, that is, we scan the whole body to ensure or to rule out the presence or absence of the disease having spread to other parts of the body. So if this happens, and then put you in either stage 1, stage 2, stage 3, or stage 4. If you are stage 1, stage 2, stage 3, you are potentially curable. Then we will give you treatment for cure. Once we want to detect cancer early, because we say early detection saves lives, I want to introduce you to the concept of screening. Screening is when you don't have any symptom of the disease, but you make a conscious effort to look out for uh, the presence or absence of the disease. So, for example, if it's breast cancer, without feeling any lump or any symptoms of anything in your breast, you walk to a screening center where you undergo a mammogram, and then the mammogram will tell you whether there's something abnormal in your breast or not. Mammogram has been found, or the screening has been found to reduce the mortality of breast cancer very significantly. So if a woman above age 40, which is the standard worldwide, goes to the clinic or the diagnosis center every 2 years, you have her breast screened or examined with a machine that can detect cancer at a stage where your hand cannot even feel, or you yourself, the patient, have not even recognized that there's something abnormal within the breast. And this can serve as a very important step in diagnosing cancer at a very, very early stage. And when you detect the cancer at this very stage, that is screening detected cancer, the rate of curing the breast cancer is very, very, very high. For example, in countries that have a well-established screening program, for example, Western Europe, breast cancer survival, 5-year breast cancer survival is about 96%. It's all due to the fact that they have screening. So every woman will be called by a general practitioner to come for the screening. It's compulsory. It's a government program, because if you detect the cancer early, the cost of treatment is much less, and the chances of curing the cancer is very, very high. And then the treatments sometimes are less toxic, because you can de-escalate treatment if you find the cancer much earlier. So it has benefits for the patient and socio-economic benefits for the country in general. So you can screen cancer, the breast, you can screen for early cervical cancer. Countries where they have a program for screening cervical cancer, the incidence of cervical cancer is very, very low, because you detect the cancer even when it's not invasive, even when it has not turned into frank cancer that can spread to the rest of the body. So it's time we also establish some of these screening programs in the country. And I'll urge every woman, even before we begin a nationwide program for screening, to regularly check her breast, go for mammography screening, go for pap smear screening for cervical cancer, then she check their prostate also. So screening is also a very important part of the cancer management in general, because you detect the cancer very early, and enormous benefits to detecting the cancer very early. So when it comes to the treatment of cancers in general in Ghana, we are fortunate to have highly qualified healthcare professionals who treat cancer. But that is one of the most important requirements for treating cancer. Because if the person administering the treatment to you doesn't have the knowledge, you may not end up well. So we have that as a country. We have clinical oncologists who are well trained, very knowledgeable in administering systemic treatment in the form of chemotherapy, targeted treatment, and endocrine treatment, and a whole lot of treatment, as well as also prescribing and delivering radiotherapy. And we have pharmacists, oncologic pharmacists trained. We have oncology nurses. In the field of radiation, we have radiotherapists who deliver radiation. We have highly qualified medical physicists who ensure doses and dosimetrics are done very well in maintenance of machines. So we have these healthcare professionals at various centers, mainly in the teaching hospitals. Komfo Anokye, and then Tamale, who Cape was also coming on board. So we have what it takes to handle cancer in terms of healthcare professional. And then when it comes to treatment in the form of medications, which are very essential in treating breast cancer, I can say we have the baseline. For example, chemotherapy. We have almost all the chemotherapy agents in the country that can treat all forms of cancers that we have. Targeted treatments, which are quite expensive, is what we don't have all of them available to us. We do have some, but not all. And they keep trickling in now and then. But I think we have to expedite the rate at which some of these targeted treatments are adopted in the country and approved in the country for the treatment of all forms of cancers. Then when it comes to the field of radiation, because the treatment of cancer generally has two fields. We have the radiation oncology and the medical oncology. We, the doctors, we are trained as clinical oncologists. We are proficiently trained to be able to handle the medical oncology as well as the radiation oncology. So the medical oncology is what I just described. That is the treatment of cancer with medications, IV medications, oral medications, systemic treatments of any kind of. And then we have the radiation oncology where we use machines, that is radiotherapy machines, like linear accelerator. And we have one in Poignant, we have one in Komfo Anokye, and there's also a private center in Accra that also has one. So when it comes to cutting edge technology, we have some of them available in the country as we speak. We use this for as targeted treatments. It's a targeted treatment that's able to deliver some form of radiation or high energy radiation to target the cancer and kill the cancer cells in any part of the body. There's also nuclear medicine where we administer radiopharmaceuticals to the patient, and it goes anywhere in the body, and it can also cure the cancer cell, kill the cancer cells in any part of the body. So we have all these treatments available in the country. And what matters most is if you want to cure the cancer, we should detect it early. Always look out for signs and symptoms of cancer which you may not have known. But what I'll tell you to look out for is anything that is abnormal. Anything that is abnormal that comes up anywhere in the body. For example, breast. I've talked lengthy about breast cancer and how to detect it. For example, colorectal cancer, any form of blood in your stool. We tend to diagnose any blood in the stool as koku. So it may not be koku, it might be the beginning of your colon or rectal cancer. So anytime you find blood in your stool, quickly go to the hospital for colonoscopy, lower GI school. Not only that, if you have any change in your bowel habits, like constipation, you are not somebody who have been experiencing constipation in the past, but you start to have something like chronic constipation, it's a warning sign. If you have intermittent diarrhea, It's a warning sign. You must look for that. If you have a strong family history of colon cancer, rectal cancer, you must also be on the lookout for cancer, colorectal cancer being diagnosed much earlier in your life. So you must pay attention to your body. That's what I'm saying. For any changes in your head and neck region, any change in your voice, any change in your breathing. Sometimes you may be having chronic catarrh. It must be. It could be at the beginning of a spinal nasal cancer or nasopharyngeal cancer. Any change in your swallowing, when there's any resistance to food, getting down your throat. It could be the beginning of your oropharyngeal cancer or your hypopharyngeal cancer. So we must be on the lookout for some of these subtle symptoms and then take the appropriate steps in diagnosing them. And then that will help us also treat it and be successful in our treatment. Because when the cancer spread or goes very advanced at the primary site, it becomes very difficult to cure the cancer. And the survival rate is much lower for such patients. So that is the brief advice I'll have for the public. Thank you.
Dr. Isaac Akosiebuwa, the pharmacy manager for adult oncology, Komfo Anokye Teaching Hospital. The cancer medicines, we don't just give it like you come to the hospital and we give you the cancer medicines. There are some medicines that we give to you before even the main cancer medicines to prepare you and to also deal with some of the side effects. Then after you have finished through, we make sure that you are okay before you go. Then we give you some medicines to deal with the side effect. So the side effects is not a problem. There are medicines that you can take to alleviate all that. And even for those that are serious, like we talk about, after you finish your treatment, all the problems will be resolved. So we should not be afraid. Whenever we are diagnosed with breast, cervical, or any of the cancers, we shouldn't be afraid. You just come. And you see that the staff, we are very friendly. We sometimes even give you our numbers so that when you have any untoward effect, you call us. We educate you on your medicine, what you should expect. So everything is done in a friendly manner. So we encourage everybody to come so that you will receive the treatment. And we are ready to serve you.
I am Dr. Paul Obin, the pharmacy manager for pediatric oncology, Komfo Anokye Teaching Hospital. 4 major childhood cancers, namely leukemia, cancer of the kidney, cancer of the eye, and Burkitt's lymphoma, are all on the NHIS. These conditions and their medications are also covered by the National Health Insurance. As a pharmacist, we liaise with central government to ensure the availability of these medicines. Thank you.
So, in summary, what I want to say is that we expect, as a hospital, we want to reduce the disease burden so that it will also reduce the work we do in the hospital. So, we expect the public to take advantage of our screening services and come for care whenever it is required. And for those who are diagnosed with new cancers, there are remedies available, either through surgery to be followed up with chemotherapy, radiotherapy, and other forms of treatment. These are all available at Komfo Anokye Teaching Hospital. My last words are that I will entreat everyone to make him or herself available of the screening services so that together we all reduce the incidence of cancers. Thank you very much.